come here, get a 3D mammogram, and know you're going to be in good hands. I was.
Donna McDermott shares her story from Houston Methodist Breast Care Center at the Woodlands, a place she learned about after attending an informational luncheon last fall.
I was in a new neighborhood, and they had opened up a new clubhouse, and they were having a lunch and learn. And they posted a sign out that said that a woman was going to come, a doctor, and talk about breast cancer, the latest technologies. And I thought, I don't want to go to that. If I need to know something about breast cancer, then I'll find out about it.
But she reluctantly attended the luncheon with a friend, and today she is thankful. It was there that she met Dr. Lauren Rourke, a breast surgical oncologist at Houston Methodist, the Woodlands Hospital.
And she talked about the latest technology of the 3D mammogram. I was so impressed with the video she had and what she had explained to us that I raised my hand at the end and said I want to have my records transferred from my hospital to Methodist.
The staff at the breast care center was able to help, and the following week, McDermott was in to have her mammogram. She quickly learned what other women had already discovered. The patient experience here is unparalleled.
We know that having a screening mammogram can be very anxiety-provoking. So we wanted to have an environment where the patient can relax, can come, enjoy a bit of a timeout, have a tea, wear a warm robe, listen to comforting music, have their mammogram, and when possible, we do try to give same-day results.
Dr. Magna Gabashi is a breast radiologist and the medical director of the Breast Care Center.
I don't think I've ever met with a radiologist before in the office. Dr. Gabashi just sat me down, and she's the one that actually sat me down at her computer and showed me the two-dimensional, and it's flips like a flip screen, and there's a breast on each side, and when she flipped to the 3D, it was just an amazing difference.
A 3D mammogram provides more information. What we're doing is we're taking multiple low-dose images through the breast, and then at the radiology workstation, we're able to look at breast tissue layer by layer. So the radiologist gets more information, we're able to be more accurate, we're able to pick up cancers when they're smaller, and we're also able to do fewer callbacks.
The 3D was actually 3D. It's like you were seeing through a glass of water, and you could actually see the spot that they were concerned about on the 3D. And that's what I saw in the film that Lauren had presented. And she presented all the different ways of doing the surgery. And so I knew when I went in and I saw that spot, what she had been talking about was what I had was cancer.
While shocked by what Dr. Gabashi showed her, McDermott admits the care she experienced made the news easier to hear.
I think the staff there is just very helpful, very knowledgeable, and their ability to explain things put me at ease, and I was very comfortable with, no matter what it was, I was in the right place with the right people.
Dr. Gabashi ordered an ultrasound and biopsy to confirm that the suspicious spot was indeed cancer. Both procedures are available at the Breast Care Center.
Here at Houston Methodist, the Woodlands Breast Care Center, we have a patient navigator, nurse navigator, who is here to help patients with scheduling, if they need a biopsy, help them get through the procedure, and then if the patient is diagnosed with breast cancer, help them get through that, help them coordinate care with our breast surgeon, who happens to be conveniently right next door. Dr. Lauren Rourke is right next door. I've worked with Dr. Rourke for over 7-8 years.
That was wonderful news to McDermott because she knew she wanted Dr. Rourke on her care team.
Once you get to know Dr. Rourke, you know that her demeanor, she's just a very kind soul, and you know that when she's talking to you, she genuinely cares about you. I probably spent an hour in her office between her nurse and her about what was going to happen, that the team of doctors were going to get together on this date, and they were going to discuss my case.
We have a weekly breast conference where the entire multidisciplinary team meets. We discuss every new breast cancer case that comes to our facility. We review it as a group. We discuss it in detail. We use evidence-based medicine to guide our treatment planning. And then the patient is given the recommendations of that entire group. So we work together, putting the patient in the middle of everything that we do. And I think the patients enjoy that when they go to see new physicians on their cancer team, that physician already knows their case.
With the recommendation of the highly skilled comprehensive team, McDermott elected to have a lumpectomy performed by Dr. Rourke and a breast reduction performed by reconstructive surgeon Dr. Ben Albright, whose office is also conveniently located on the same floor.
Well, we have a very similar philosophy. Of course, we want the best outcome for our patients. And we have organized our schedules so that our clinics are aligned on the same day. So, we can discuss patients and their individual cases at the immediate time that they're being seen in clinic. It's not uncommon for me to go across the hall to Dr. Rourke's office or vice versa. She'll come over and see a patient. That way the patient only has to get undressed one time for examination. She sees both of her providers in the same room. And really it's optimal for the patient. It's very convenient and puts them at ease and provides some comfort that you wouldn't get if you went somewhere else.
Along with receiving personalized care by a comprehensive team, McDermott would also receive the benefits of a new technology called Savvy Scout. Houston Methodist The Woodlands was the first hospital in Montgomery County to offer the cutting-edge procedure.
The Savvy Scout technology is a huge advancement for the way we take care of breast cancer in women today. For women that have a breast cancer that we can't feel, we use the Savvy Scout now in lieu of what we previously did wires for a localization procedure. Now we have the option of having a breast radiologist deploy a small, about 1.2 centimeter metallic device that goes into the cancer. It marks the spot. The patient can drive themselves to this procedure, go home and about their business that day, and then have surgery anytime within a month after that.
On the same day, immediately following McDermott's lumpectomy, Dr. Albright performed the breast reduction.
Every patient's unique. They have different circumstances, and their experience going through a disease process is different. I like to kind of help navigate the reconstructive side of that experience. And ultimately get them back to normal function, normal form, and just a normal routine. And so if I can do that and get to the point where I can discharge a patient from my practice, knowing that they're happy with their outcome and they're not going to have to come back again and again, long term, then I've done my job.
After the surgeries, McDermott and her team together decided her treatment would include 20 sessions of radiation, a service now available at Houston Methodist Cancer Center, located in the same building as the offices of these breast health experts. Should patients need chemotherapy, the infusion center also opened this year.
We have every aspect of treatment for a breast cancer patient all in one building here at our Woodlands facility. We have breast surgery, we have medical oncology, we have radiation oncology, we have plastic surgery, we have a full service imaging center, an infusion center, so anything that the patient could need is right here in one place.
Today, McDermott visits her doctors for follow-up appointments, but is happy to announce she is cancer-free.
I don't know what it would be like to go through cancer any other way, but I know that the journey that I went on, I felt like I was, my hand was held, I was carried, I had the best doctors. I've never really attended a Methodist hospital before, but I do know that Dr. Gabashi, Dr. Rourke, Dr. Albright are, they are in this profession because they care and they want to take care of you. You can have a lot of bad things happen. You can have health issues, you can have situations come up. And the difference for me, what I found is that what the difference it makes is who takes care of you, who is educating you, how your journey will be and how you can end up. I can't imagine it being any other way.